So, good afternoon. My name is Laura, and I'm currently an education consultant in Algorithmics International School for Coding and Design. So, we currently teach our children, Indonesian children actually, in Indonesia in coding and AI. But the thing is, I would like to know, what do you think and how actually technology can assist healthcare investment about AI especially? And secondly, there is an opinion arise among the healthcare people internationally that women's body is less researched than men. So let's say it's about, this is quite sensitive about feminism. But yeah, let's say that our healthcare is being generalized using men's body. Let's say for a woman's symptom during their pregnancy, digestive symptoms, let's say, it's actually, the research found out that it can be prevented using a certain medicine that helps to stabilize the hormone. So how do you think that we can actually, improve our healthcare, not just for men, but also for women? And how do the technology can assist this? Thank you.
Okay, that question, who will be willing to?
I can try. So I'm joining as Global AstraZeneca. We are collaborating many AI startups. For example, we believe the future is very much right. The future is coming, right? We have to act on now, right? What we can do. And I agree with you. There are many AI tools to close the care gap, right? For example, there are tools that we are collaborating globally from the X-ray, how we can screen, the X-ray and then diagnose the respiratory diseases, even the lung cancer incidental nodules on the lung, and then diagnose early and then treat them early. Because, for example, in a situation like cancer, right, we have to diagnose patients early to make sure that we treat early and also save them. So that's one area that we are working, and there are many tools like that. The other thing to me, for example, tools like telemedicine, which is also, to me, Indonesia is also growing significantly, right? Some of those telemedicine opportunities, I think, can help to reach to the patient or layman, understand the health problems, diagnose them early, treat them early as well. So that's the part on the AI, maybe.
And try to answer the women and men differences. In doing my research, I'm still active researcher. I don't think, we see the differences, obviously. So we try to be mindful in terms of randomization of our either respondents or we using in vivo models, like animal models, to study the mechanism of disease. We always make sure we have both sexes into our cohort. And then in terms of women health, maybe you will see it from one perspective, but for example, the oncology, breast cancer is the most researched type of cancer with the most funding available. So I kind of see your point, but then also there's another perspective of that. I don't think women are kind of left behind in terms of research. And more understanding of how physiology of women and men differences in physiology contribute to the disease development has been put into consideration when we design our research. Pregnancy, for example, there is a study that says that it actually can contribute to faster development of bowel cancer, but it's in very, very early stage. So big study needs to be done and things like that. There's a lot of study on women as well. And then in terms of AI in our company, our startup company, we developing harnessing AI for digital pathology. So we have algorithm for cervical cancer detections, and some colleagues who deal with radiology, as I mentioned, also you harnessing AI. So it's quite promising. Thank you.
Because of the for the AI, the deployment, the R&D, it also accelerates the process of clinical trial and also what model, the right model to find a new molecule, new treatment to the patients. But actually, close to our heart is that the deployment of AI for the patient support program. Currently, there's a chatbot to support the patients to answer their concern, to find a better and faster information in regards to their condition. But I think while we have a public-private partnership here, one of the key topic that we also need to maybe work on together is that how we can have responsible AI deployment and development. Because AI is a technology, but of course, in terms of implementation in every market, also will depend on the framework, the regulation, to have a responsible that way we can, what we call acknowledge of data privacy and also all that sensitive concern coming maybe from the public. So maybe that's a quick add.
Thank you for that, and I think that's a very interesting question. For a moment, I thought we can't open more men than women, but then I thought, on a second note here, I think there are more diseases that are suffered by women than men, right? We tend to carry more of, maybe we have more organs in our body or the hormonal imbalances and all that thing. So I'm sure, like Dr. Susanti said, there is more research also being conducted on women. But thank you for that interesting question. So we have, sir, please introduce yourself.